Hello everyone and welcome to the Cut Hypertension training video. So the purpose of this video is to give an overview of HSTAT and the Cut Hypertension program. And we'll also be providing some education on hypertension that will hopefully illuminate why it is what we do. So Health Students Taking Action Together, or HSTAT, is a nonprofit member organization run by health professional students in Georgia. We aim to help the Atlanta community through program outreach and health advocacy efforts. The Cut Hypertension program is one of our community outreach programs. Our aim is to reduce the prevalence of uncontrolled hypertension in the Black community by partnering with local barbershops and engaging students from across disciplines in service and education. So our mission is to build relationships with Atlanta community members to provide free blood pressure screenings, heart health promotion, and linking to existing healthcare services. We are empowering local leaders that have deep connections to our community, such as barbers, pastors, and health professional students, to become health advocates to promote continuity of care and destigmatizing health for Black men. We hope community members are more aware of heart health, stronger advocates for health for themselves and others, and experience improved health outcomes as a result of cut hypertension screenings. We aim to reduce health disparities among racial minorities through greater access to healthcare services, stronger relationships with community leaders, and reduce barriers to health. So let's talk a little bit about hypertension. So high blood pressure, also known as hypertension, is when your blood pressure, the force of blood flowing through your blood vessels, is consistently too high. So just a few statistics. Nearly half of all American adults have high blood pressure, but only 1 in 4 of these adults have it controlled. And many are unaware that they have high blood pressure. And it costs the United States $131 billion each year. In most cases, the damage done by high blood pressure takes place over time. Left undetected or uncontrolled, high blood pressure can lead to serious health consequences. This damage to blood vessels can lead to heart attack, stroke, kidney disease, vision loss, among others. The increased workload from high blood pressure can cause the heart to enlarge and fail to supply blood to the rest of the body, which is also known as heart failure. And there are a number of risk factors for high blood pressure. There are a handful of hereditary and physical factors that increase the likelihood of developing high blood pressure. So these include family history. So if your parents or other close blood relatives have high blood pressure, your risk increases. Age, the older you are, the higher your risk. Gender is interesting. So until the age of 64, men are more likely to get high blood pressure compared to women. But at the age of 65, this flips. So at the age of 65, women are actually at higher risk. And lastly, race. So African Americans tend to develop high blood pressure more often than people of any other racial background in the United States, and it tends to be more severe. And then the middle section is modifiable risk factors. These are the risk factors that you can change and take preventative measures to decrease your risk of having high blood pressure. So a lack of physical activity. We all know that exercise is great for your health, and it's no different for hypertension. An unhealthy diet, one that's high in sodium especially, can increase your risk. Being overweight, drinking too much alcohol, or smoking and tobacco use all increase your risk of having hypertension. So this is really where we focus our education with community members. We want to stress the importance of being active, having a healthy diet, and limiting alcohol intake and quitting smoking. And lastly, there are certain medical conditions and diseases that can increase the risk of developing hypertension, such as diabetes or having high cholesterol. So it's important to manage the primary disease to decrease the risk of secondary health complications like hypertension. And rates of high blood pressure vary by sex and by race. So 47% of men have high blood pressure compared to 43% of women. And then on the graph on the right, it gives the percentage of adults with hypertension by race and ethnicity. That darker blue bar represents the total percentage. And then that teal bar is the percentage of that is controlled. So just want to point out, as you can see, among the African American population, 54% of adults have high blood pressure compared to 46% of white adults. However, the percentage that is controlled is lower. So only 25% of African Americans that have hypertension are controlled compared to 32% of white adults. And high blood pressure is known as the silent killer. This is because you can't tell that you have high blood pressure by symptoms. There are no symptoms. The only way to know if you have high blood pressure is to have it measured. But the good news is that blood pressure screening is easy, safe, and cost effective. So when you take your blood pressure, when you go to the doctor to get your blood pressure, it's important to understand what the readings mean and what these numbers represent. So your blood pressure is a result of two different forces. The first force, or your systolic pressure, occurs as your heart is actually beating and blood pumps out of the heart and into the circulatory system. And that's the first number of your blood pressure reading. The second force, or your diastolic pressure, indicates the pressure as the heart rests between beats. And that's the second number. So when you get a blood pressure reading, it's important to understand what the numbers mean and what is considered a normal reading, whereas what is a concerning reading. And the exact goals depend on the individual's age or other medical conditions. But in general, the 5 blood pressure ranges as recognized by the American Heart Association are in this table. So blood pressure numbers of less than 120/80 are considered within the normal range. I don't want to go step by step through this table, but I do want to point out a couple things. So normal readings is less than 120 systolic and less than 80 diastolic. And so you'll notice this and or column in the middle. And I just want to highlight that because as you can see, there's kind of 2 different stages for hypertension. There's hypertension stage 1 and hypertension stage 2. And those are both depicted by first the light orange and then the darker orange color. But you can see that hypertension stage 1 is a systolic of 130 to 139 or 80 to 89 diastolic. It can be one or the other. You can have a systolic of 120, but if your diastolic number is between 80 and 89, you're still considered to be in the hypertension stage 1 category. And the same is true for the hypertension stage 2. It's either or. So when we are out in the community taking blood pressure readings, we want to educate folks that are in the elevated category that they are at a risk for getting hypertension in the future. And so it's important for them to really focus on those modifiable risk factors. And then if we take a blood pressure and someone's either in hypertension stage 1 or stage 2 for our reading, we want to wait 5 minutes, take the blood pressure again. And if it's consistently elevated or high, we want to refer them to those community health resources to then receive a diagnosis and receive further education from a physician. So what does it look like to volunteer with cut hypertension? So a small group of us, 3 to 4 volunteers per visit with 1 lead volunteer, go to one of our community partners. And we try to go to one of our community partners about every other week. And each visit is approximately 2 hours. We're there to measure customers' blood pressures, discuss results, and connect community members to local health care resources. Volunteers can also be involved in our other service events, which in the recent past have included COVID-19 pop-up vaccine clinics. And we also participate in community block parties so that we can provide service and education alongside other participating programs. And the other programs that are involved in the block parties provide other services. So together, it's a really amazing event. Just to note, no prior experience or medical background is necessary to volunteer. Hours are flexible, so there's no minimum volunteer time commitment. And then in regards to the short training, so you're already doing the first part, which is watching this video, then there is another video that just shows how to take a blood pressure. And then there's a brief online quiz to complete following these videos. And then following those things, you will reach out to the program director, which is the contact information is above on the website, and schedule a time to demonstrate and practice taking a blood pressure before going out in the field. And then you'll be all ready to volunteer with us. So lastly, just a few like do's and don'ts for screening events. Most of these should be pretty self-explanatory, but please, when you're out in the field, offer to take blood pressure and discuss the result, answer any questions about hypertension, and provide education on those lifestyle modifiable risk factors, and refer to community and local healthcare resources. And we will have these for you. You don't have to have prior knowledge of them. And then always be professional, compassionate, and respectful. Please do not force anyone to get a blood pressure reading if they do not want one. We are not there to diagnose hypertension. So that's a big one. We can say that we have a concern, but we are not there to diagnose, only to refer and create awareness. And please do not take a blood pressure in someone's arm if they have a shunt or tell you it's used for dialysis or any other contraindications, which can include like a mastectomy or history of blood clots. And please do not address any other health concerns. Thank you all for watching, and we look forward to working with you.